Good morning, everyone. My name is Dr. Kyle Kopko, and I have the privilege of serving as the Executive Director of the County Commissioners Association of Pennsylvania. I want to thank all the media representatives, legislators, and supporters that are joining us here today. I am joined by members of our CCAP Board of Directors who will be presenting the 2026 legislative priorities chosen by counties across the Commonwealth. CCAP was founded in 1886, and we are celebrating our 140th anniversary this year. Our goal is ensuring that our counties and county officials can effectively and efficiently advance local governance and policy. The 67 counties of Pennsylvania have come together and have selected 3 priorities that represent their proactive legislative agenda in 2026. Our members from counties large and small, urban, suburban, and rural, selected these 3 issues because they are of the greatest significance and viewed as the most impactful for our counties in the coming year. Achieving these priorities will not only improve county government, but more importantly, will improve communities across all of Pennsylvania. We at CCAP firmly believe that if our counties are strong, the entire Commonwealth is strong. Our 2026 county legislative priorities include sustainable 911 funding and statutory updates, adequate county mental health funding, and assistance for counties to conduct timely reassessments. These priorities reflect our enduring commitment to providing exceptional services while using tax dollars in a responsible manner. Achieving these priorities are essential to providing critical services to the 13 million residents that call Pennsylvania their home. The policies that you'll hear about today directly affect our health, our safety, and our economy. And we are here at the Capitol because in order to achieve these goals and in turn support all Pennsylvanians, we need strong partnerships with our colleagues in the Shapiro administration and the General Assembly. And we look forward to working with them to achieve these goals. And one quick housekeeping item before we formally begin. When the presentation concludes, there will be an opportunity to conduct one-on-one interviews with county leaders here in the Rotunda for about 15 minutes. And with that, it's my pleasure to now introduce Snyder County Commissioner and CCAP Board President, Joe Kantz. Commissioner Kantz.
Good morning. As the 2026 CCAP President, I'm honored to announce our #1 priority this year as voted on by our full CCAP membership. While counties deliver a wide range of essential services, our top priority remains ensuring sustainable funding for one of the most critical public safety tools in Pennsylvania, the 911 system. Counties are calling for an increase in the monthly 911 surcharge to provide stable, long-term funding so that we may maintain and modernize 911 operations and ensure reliable emergency response across the Commonwealth. Through the statewide Next Generation 911 system, highly trained telecommunicators serve as the first responders for millions of callers each year, often providing life-saving instructions while police, fire, and EMS are dispatched. This is a service counties are proud to provide, but as technology evolves and costs rise, counties need a consistent and sustainable funding structure to continue fulfilling the responsibility. As the poster to my left shows, Pennsylvania's 911 system handled more than 13.9 million calls in 2024, more than 1 call per resident. This is a 24/7, 365-day-a-year public safety service, and its costs continue to grow. From 2016 until 2024, counties have been forced to rely increasingly on local property tax dollars just to keep pace with rising costs. Meanwhile, surcharge revenues have remained relatively flat and have not kept pace with inflation. That imbalance is why counties are urging the state to raise the surcharge to no less than $2.20 through 2028. Even at that level, the surcharge would still fall below inflation. When the surcharge was first adopted in 1990, the fee was set at $1 per month. Adjusted for inflation, that amount today would be more than $2.48. Counties continue to work closely with PEMA, the General Assembly, emergency management professionals, and industry partners to strengthen and improve the system. With proper investment, we can enhance efficiency, accuracy, and reliability, especially during critical emergencies. I'll close with this. When someone calls 911, nothing else matters except knowing a trained professional is on the line and that help is on the way, accurately and without delay. I would now like to introduce Greene County Commissioner Betsy McClure to discuss in greater detail our goals related to the adequate county mental health funding. Betsy?
Thank you, President Kantz. To witness the conversation around mental health evolve throughout the years has been a great experience. We are breaking down stigmas. People are understanding themselves better and willing to get the help and support they need. Mental health awareness has taken a big step forward. Unfortunately, the ratio between mental health awareness and investments in the mental health system is becoming dangerously disproportionate. Counties deliver critical mental health services such as community residential programs, family-based support, outpatient care, and crisis intervention on behalf of the Commonwealth. On the chart to my right, you will see how many of these funds are allocated in each county. Counties have stretched the limited state funding to serve as many residents as possible, but we are now at a breaking point. This is our reality. Inadequate state funding paired with increasing demand has pushed the county mental health system to the point of collapse. On the display to my left, you can see the counties have served more than 700,000 community members per year since the 2015 fiscal year. However, adjusted for inflation, we are receiving nearly $35 million less annually to provide those services. To avoid this, counties are asking the legislation and the governor for a $40 million increase this year and sustained annual investments in the state's mental health community-based system to help counties maintain and rebuild the existing safety net of services. This would also help reduce delays for residents who frequently report waiting at least 6 months, often much longer, for services. Stabilization of these existing services, like addressing workforce gaps, is a critical first step. The unmet community need has created a growing population of individuals that become involved with emergency departments, law enforcement, and criminal justice system. When no appropriate diversion exists, the remaining solutions are hospitals or incarceration, both of which are not appropriate settings for mental health treatment and more costly. This is bad for residents, it is bad for counties, and it is bad for Pennsylvania. This is not a problem that can be swept under the rug. We all know someone that has dealt with mental health issues, whether treatment is needed by an elderly parent, a spouse, or a child outside of the school environment. And finally, everyone in Pennsylvania should be able to access timely, appropriate mental health services without undue burden. I would like to now turn it over to Huntingdon County Commissioner and Chair of CCAP Assessment and Taxation Committee, Jeff Thomas, who will introduce our final priority, assistance for counties to conduct timely reassessments.
Thank you, Commissioner. This is starting out well. You're still here and haven't rushed to the podium. And here's our third priority. Pennsylvania counties are responsible for conducting property reassessments to ensure that property values accurately reflect current market conditions. While state laws set the framework, the administration, funding, and timing of reassessments fall squarely in the counties. As you can see on the first poster board to my right, there is a wide variation across counties in when they last conducted countywide reassessments. This is because determining the need for a reassessment is a local decision influenced by complex factors like market conditions and the capacity and readiness of the county staff. Reassessments in Pennsylvania are revenue neutral. They do not increase taxes. Rather, they ensure property values are fair and current, so each property owner pays their fair share based on today's market value. Reassessments correct inequities over time and do not set tax rates or raise overall revenue. While essential for fairness and equity, reassessments are costly, technical, and resource intensive, especially for counties that have not done one in many years. So, the second poster board to my left highlights the significant costs faced by counties that have recently completed or are in the process of conducting reassessments. Because reassessments are costly and intensive, counties often face challenges conducting them on a regular basis. Furthermore, infrequent reassessments can result in mixed economic development opportunities and challenges in maintaining equitable property values. To address these challenges and bring greater uniformity, Pennsylvania counties are advocating for initiative, sustainable funding to support reassessment efforts. This includes authorizing a modest recording or deed fee to help offset assessment-related costs and support ongoing improvements to local assessment systems, as well as establishing a reliable statewide grant program. Counties also support building a strong state-county partnership, designating an appropriate state agency to oversee assessment funding and develop attainable standards for fair and equitable assessments. Finally, counties support the authorization of a legislative study to examine Pennsylvania's property valuation and reassessment system and identifying opportunities for reform. Property reassessment is always a hot-button issue, but with the right policy changes, we can make the process more efficient, timely, and accurate for the benefit of all Pennsylvanians. I'd like now to turn it back over to Cal for closing remarks. Thank you.
Thank you, Commissioner Thomas. Now, there are many other legislative and regulatory proposals that will require our attention this year. However, these three priorities represent critical issues that must be addressed, not just to ensure effective county governance, but to support our constituents. Our legislative priorities will rely heavily upon a strong partnership with the Shapiro administration and the General Assembly, and we look forward to working with our colleagues in the legislature and the executive branch in the coming months. That partnership is critical to county's mission to effectively maintain healthy, safe, and resilient communities. Together, we can implement solutions that better reflect the needs of Pennsylvanians, improve the stewardship of taxpayer dollars, reduce costs, increase local flexibility, and assure the quality of services that we provide. I encourage all of you to visit the CCAP website at www.pacounties.org, where you can find more information about these priorities and how counties provide a wide range of essential services in support of the Commonwealth. And again, I want to thank everyone who attended today's event, and we will conclude the presentation with one-on-one Q&A with our board members here shortly. Thank you very much and have a great day.